They call him OD. His name is Dr. Orain Thomas, and he's along with a team of doctors at the Maypen Hospital. Recently performed a successful laparoscopic colon surgery that has revolutionized treatment at the facility. And he's with me now. Morning, Doc. Good to see you.
Morning, Neville.
How are you?
I'm good. Happy to be here.
Yep. Laparoscopic surgery by itself is not new.
No, it's not new. So laparoscopic surgery has been in Jamaica for maybe over 20 years,
right.
2 decades. In terms of colon surgery, sorry, it has been in Jamaica also for a good while. The standard or most practiced laparoscopic surgery is usually gallbladder surgery. So that has been at Maypen actually for a good while, about a decade or so.
But the colon
surgery is new.
Is brand new.
Is new to Maypen.
Yeah. Laparoscopic means you have a little camera.
Yes. So it's usually very tiny incisions, tiny cuts that are made in the abdomen just to facilitate the size of a pen. Just imagine a pen, the diameter of that's usually the size of the instruments that we use. And usually about 4 of those small cuts are made, and then small instruments are inserted through that. And then a camera is used, and the image is projected on a screen, and that will, through that now, we can do whatever surgery.
Which is what I find amazing, because after you make, well, you say incisions, but after you make the cuts,
right.
you actually look at the screen while you're working, so you're not actually looking at the patient.
No.
Does that require a different kind of medical training?
Yes, it does. It really is technical, right? And over time, you get a grasp of perception, the whole view of that area of the abdomen. You have to, do a number of surgeries in order to what we call navigate the learning curve.
Right.
So usually it takes a good amount of these surgeries in order to be proficient. And thankfully, I got my training at the University Hospital of the West Indies. Big up, UWI.
Brilliant.
Yes, the general surgery program there heavily emphasizes laparoscopic surgery. And we have very, very good consultants there.
And I just wanted to tell the viewers that I apologize for this question because it might make you because normally you would have to make a big cut and literally physically look inside the stomach area.
Yes, that's true. It's not usually across, but it's usually down.
Down.
The standard, yes. So the standard.
And I'm saying in a layman's term, you actually have to open up.
Yeah, man. It's usually the standard surgery. Usually starts from right just below the
sternum. That's what we're looking at there.
Right. Yeah. So it's usually a midline cut. About the length of the abdomen.
Ooh.
Right. So.
And now you're just making
small cuts. So you can imagine the difference in terms of pain, the difference in terms of the cosmetic outcome, and there are a number of other benefits. So because we're not touching the bowel or touching the internal organs, usually they start working quicker after surgery. So that allows the patient to start eating earlier, be up and about from day one, and they're able to go back to their regular activities.
If laparoscopic surgery has been around for a long time, why just now the colon? Why?
At Maypen.
At Maypen.
Well,
you just never had the equipment? Is that it, or you never had the expertise? Which one?
Well, it's a bit of both.
Okay.
Right. So colon training in Jamaica has been somewhat new, laparoscopic colon training. So at the University Hospital, this has been a new initiative, or has been pushed in the last few years, the last 5-6 years, in terms of training persons locally. And I'm a product of that. And thankfully, I'm able to bring that to my hometown, Maypen.
Brilliant. Where or what is your colon?
Where's the colon? So the colon is basically the large bowel or large intestine or tripe. That's
what we're looking at there?
Yes, that's it. So that's the last part of the digestive tract where basically all the waste product will be stored, and then not really stored, but that's where it passes through, and then it becomes stool. So that's pretty much what it is.
Maybe you can use a percentage here as opposed to an exact number, but what's the difference in cost here if using laparoscopic
versus standard.
Versus standard.
So in the public system, the main drawback is some of the disposable instruments that we have to use, meaning the ones that we have to throw away and use for each patient. So we have a standard laparoscopic tower with the camera and set instruments, but then patients would have to pay for like energy device. Energy device is that instrument that we use to basically make the dissection or make the cut, and helps to speed up the surgery. So that the patient would have to foot the bill for that. It's about a little over 100,000 for that device, in addition to some other instruments.
A little over 100,000 for that device alone.
Yes.
So what would the surgery cost then?
So in the public system, yes. So it would cost, with everything, it would cost about 200,000 actually.
Well, that's not terrible.
Yeah, it's not bad. Thankfully,
well, I say it's not terrible, I mean, some of us can't even think of that.
Yeah,
but
so for the one that we did at Mapen, the first one, that was, thankfully we had some private partnership. They were able to sponsor some of the instruments that we use.
And even though the camera goes in, you can use the camera again?
Yeah, man. So the camera is sterilized and some other instruments are sterilized.
Yeah.
Unfortunately, the energy device can't be sterilized, so we have to, replace it for each patient.
We keep talking about Mapen Hospital, which is why you're here. But how many people would have come for colon issues before this, and how life-changing is this? So,
unfortunately, colon cancer is pretty much on the rise. Wow. It is very common. And just speaking from Mapen, I've been back since February, and I've seen maybe close to 15 or so patients with colon cancer, or over 15. But unfortunately, they usually present very late.
Wow.
All right, so I really want to hammer this point. That's probably one of the limiting factors in terms of doing laparoscopic surgery, because most patients, they will present after complications. So they will come in with bowel obstruction, they will come in with bleeding, all
does that mean you can't use?
Yes, it does make it very, very difficult.
Very difficult, or you can't do it?
Well, it's not advised to do it in those settings.
Okay.
Right, very dangerous.
Okay.
Right, so usually we prefer to do it in early diagnosis. And usually early diagnosis is made like with screening, with colonoscopy. Right, so this is the standard recommendation, is that you do screening colonoscopy starting from age 45.
Okay, so that's the reason they come in late, because they just don't. It's not that they know I'm free to come to the doctor.
Right.
They really just don't know.
No, exactly. You won't know until you start having symptoms.
Symptoms like?
Symptoms such as bleeding, meaning bleeding, passing blood with stool, weight loss, abdominal pain. Those are,
right. How long is it the surgery, and how quick is the recovery time?
So the surgery standard is about 3 hours. Can be more, can be less.
And successful surgery recovery time is?
Recovery time is, well, in hospital, you are able to go home within 3 days. In terms of going back to your regular activity. So, for example, this patient, she was back to work within 2 weeks.
Oh, beautiful. You never had this, I say you, Mapen, I'm talking about. Right. Mapen never had this because of what? It was the cost was too high? Why is Mapen just doing it like now? Why?
So, one, we didn't have the expertise.
Didn't have the expertise as in a physical, colon, as in a physical doctor here we're talking about. Okay.
Laparoscopic.
Okay.
That was trained in laparoscopic surgery for colon.
Right.
But we've been doing laparoscopic gallbladder surgery for many, many years.
Okay.
We've had surgeons there who been doing laparoscopic surgery for gallbladder.
Where else apart from the abdomen area could laparoscopic work?
So laparoscopic can be done for issues with the chest. So like lung surgery.
Okay.
Right, but it's a different name, of course, but it's the same, it's pretty much the same technique.
Yeah. Why did you want to be trained in that area?
Well, it's a part of the general training, part of general surgery, right? And why did I choose general surgery?
Yeah.
Because of the diverse pathologies that we, are able to treat. including cancers, non-cancer cancer conditions, trauma, right? And I think I'm able to reach a lot of persons doing this specialty. And I think, I mean, it allows me to, impact a broader,
right.
A broader population.
Yeah, you seem to be a very young man, but you seem to be very experienced at this. And
yes, I am actually.
I thank you for that.
Thank you.
You said your hometown, you're from Maypen.
I'm from Maypen.
Which is the reason you went back to that hospital?
Yes, that is the reason.
Fantastic. And you're not going to leave us on?
No. No plans of doing it at all.
You're not going to Washington or anything like that?
No, not permanently.
Thank you so much for your service.
Thank you.
And thank you so much for coming in this morning.
Thanks for having me.
Well explained. General surgeon, and can I ask, what I say, laparoscopic surgeon too? No?
No. General surgeon.
General surgeon. Dr. Orain Thomas, as I said, they call him OD. For, I guess, a different reason they call me OD, but I don't know. 10 minutes to your health. We'll do it again next Thursday. All right, when we come back, we look at some of those good and proper wooden items. I think Garticus will have that one. Soon come.